Island Nurse, and welcome back to my YouTube channel. Now in this video we're going to be talking about diabetes. So let's go ahead with our working definition. So diabetes is a chronic disease or disorder that is caused by an acquired or an inherited deficiency in the production of insulin by the pancreas, or an ineffectiveness in the insulin that is already produced. Now, let's examine some of the words that are highlighted here so we can get a better picture of what this disease entails. So we know that it is chronic, meaning that it is a disease that is going to require constant medical attention. We also know that it is inherited, meaning that there is a genetic link. It is acquired, meaning that you can get it without regards to genes. We also know that it has something to do with insulin, and we cannot speak about diabetes without talking about insulin. And we also know that it has something to do with the ineffectiveness of insulin in the body. So let's talk a little bit now about insulin and its role in the body. Now, when we eat, particularly foods rich in carbohydrates, these foods are broken down into simple sugar called glucose, and our cells need glucose for energy so that we're able to perform our functions. Now, the cells cannot utilize this glucose or absorb this glucose without insulin. So whenever we eat, insulin is released into the bloodstream, and the insulin helps the cells to absorb this glucose so that it can convert it into energy, so then we are able to perform our functions. Now, if we eat in excess of what we need, sometimes we overeat, our body does not require all of the food or all of the glucose. Insulin takes that glucose and converts it into glycogen and stores it in the liver for future use. Now, during periods when our blood sugar is low, such as when we're exercising or if we haven't eaten for a period of time, there's another hormone by the name of glucagon that acts in the exact opposite way of insulin. So glucagon is going to take that glycogen that has been stored in the liver and convert it back to glucose and release it into our bloodstream. So that is why even if you haven't eaten for a day or two, you will not, let's say, just drop dead, because your body has a way of trying to increase your blood sugar in order to sustain you. Now, we're going to move on to talk about the types of diabetes. Now, there are 4 types of diabetes. We have type 1 and type 2. There's gestational diabetes, and there's a condition known as diabetes insipidus, which really is not diabetes in the true sense, but because it has some of the same symptoms of type 2 diabetes, that is why it is called diabetes. But for our purposes today, we're just going to focus on type 1 and type 2. So type 1 diabetes was previously called juvenile onset diabetes because it came about, or the onset was usually in childhood. However, that is not true anymore. We don't use that term. That's an outdated term, because with the onset of childhood obesity, we're seeing a lot of young people and children developing type 2. And type 2 was previously called adult onset diabetes. So let's compare and contrast. So type 1 is also referred to as insulin dependent, and that is because in the management of type 1 diabetes, most people use insulin. And in type 2 diabetes, it is referred to as non-insulin dependent diabetes, because in the management, people tend to use, they may or may not require insulin. They can use oral anti-diabetics or combination of both, or sometimes it can be managed with just diet and exercise. Type 1 diabetes is an autoimmune disorder, meaning that the body attacks the cells of the pancreas. So for some reason, the body recognizes the cells, the beta cells of the pancreas, which produce the insulin, the body recognizes those cells as foreign and attacks the cells, and therefore insulin is not produced. Type 2 diabetes is usually caused by lifestyle factors such as obesity, eating unhealthy, like a diet that's high in cholesterol, lack of activity, so people who don't exercise. And it is said that when a person is obese, the fat prevents the cells from being able to utilize the insulin in the body. Type 1 diabetes has a very strong genetic link. Type 2 diabetes has some genetic link, but it is more so caused by lifestyle factors. In type 1, you have little to no insulin being produced by the pancreas. In type 2, you have what is called insulin resistance, meaning that the person can be producing insulin, but the body does not know how to utilize the insulin. And in type 1, there's a sudden onset, and in type 2, the onset is gradual. Now, let's talk about sugar and the role of sugar in causing a person to develop diabetes. Now, many people usually think that eating too much sugar contributes to a person becoming a diabetic. Now, that is true and false at the same time. So, let me explain why. So, like we said, type 1 diabetes is an autoimmune disorder, right? Meaning that your body, for whatever reason, is just attacking the cells of the pancreas. And like we said, there's a strong genetic link. A person developing type 1 diabetes, this has absolutely nothing to do with them eating sugar. So even if you were to eat 1 pound or 2 pounds of sugar every single day, it will not cause you to develop type 1 diabetes. Now, for type 2 diabetes, the role of sugar is more indirect, in the sense that when you eat too much sugar, right, when you eat foods that are high in carbohydrate content, it can lead you to developing obesity, and obesity is a risk factor for the development of type 2 diabetes, because remember we said that the fatty tissues prevent the cells of the body from utilizing insulin. So sugar, in terms of eating too much sugar, if that causes you to develop diabetes, yes and no, but it is more an indirect link. That is not to say that you should just go about eating sugar, because once you are diabetic, then you have to control your sugar and your carbohydrate intake. Okay, so let's talk now about how we diagnose diabetes. How do we diagnose diabetes? So we have here pre-diabetes and diabetes. So in pre-diabetes, your blood sugar is high. It's higher than normal, but it is not high enough for you to be classified yet as diabetic. And so the normal blood sugar is from 70 to 120 milligrams per deciliter. That's important for you to remember. So in pre-diabetes, if you do a fasting blood sugar, meaning that the person would have stayed away from food for 8 hours prior to the test, if it's from 100 to 125 milligrams per deciliter, the person is diagnosed as pre-diabetic. However, for them to be diagnosed as diabetic, it has to be 126 milligrams per deciliter or more. Also, you have an oral glucose tolerance test, and this test is done by initially the person would fast for 8 hours prior, and when they go to the lab tech is going to do a fasting blood sugar, and then the person ingests 8 ounces of glucose, a special glucose drink, and then the blood sugar is tested at intervals, so at the half-an-hour interval, at the 1 hour interval, at 2 hours, and at 3 hours. And if the blood sugar is between 140 to 199 milligrams per deciliter, the person is diagnosed as pre-diabetic. If it is 200 milligrams or more, then the person is diagnosed as diabetic. Also, we have the hemoglobin A1C. Now, this test is a test that measures how much glucose is bound to red blood cells. So when your blood has a lot of glucose in it, this glucose likes to bind to hemoglobin. So this is what this test measures. And if it is 5.7 to 6.4%, it is measured as a percentage, then the person most likely is pre-diabetic. And if it is 6.5% or more, the person most likely is diabetic. Now, it must be noted that this blood test is really a true measure of how well your diabetes is controlled rather than a diagnostic test. However, it is done in conjunction with other diagnostic tests. But you will not do this test on its own in order to diagnose diabetes. So this test really gives an indication of how well your diabetes has been controlled for the past 2 to 3 months, because red blood cells live for that period, for 2 to 3 months, then they disintegrate and then they regenerate. So that is why this test is an indication of how well your blood sugar has been controlled for the past 2 to 3 months. And for diabetes also, there's one other diagnostic criteria, and this would be that the person has the classic symptoms of diabetes and they have a random blood glucose, meaning that you can go at any period in the day, you don't have to fast. And if that random glucose is over 200, plus you have symptoms of diabetes, then you can be diagnosed. So it's either or for these tests. It's not all of them combined, it's one or the other. So let's move on now to talk about some of the classical symptoms of diabetes. The first one is polyphagia, and this means excessive hunger. And this happens because, remember, there is a problem with insulin. If there is not enough insulin in the blood, remember, the cells are not able to utilize the glucose from the food in order to convert it to energy. And when this happens, the person ends up feeling very hungry even though they have just eaten. We also have polyuria, which is excessive urination. And this happens because of a process known as osmotic diuresis. So the kidneys try to excrete the excessive sugar, and when the kidneys excrete the sugar pulls water with it. It's almost the body's way of trying to compensate or trying to dilute the sugar in the blood. And so because of that, the person ends up having excessive urination. And followed by excessive urination, we have polydipsia, which means that the person will be very thirsty. So if you're passing out a lot of urine, it means that your cells are deprived of fluid and you end up feeling extremely thirsty. And glycosuria refers to sugar in the urine, like I just mentioned. Because of the excessive sugar in the blood, the kidneys are working overtime to try to get rid of that excessive sugar. One other symptom you may notice is that the person feels excessively tired, and again, that has to do with the fact that the cells are not able to utilize the glucose from the food that we eat in order to convert it into energy. And if that is happening, it means that you feel tired and listless and lazy all the time. So there you have it. We've discussed the definition, we've spoken about the types of diabetes, we've also spoken about diagnostic criteria, and we went over some of the major signs and symptoms of diabetes. Now in our next video, we'll go more into talking about the management of this condition. And as always, if you found this video informative, don't forget to like and subscribe. See you next time.